Where do you feel that patients' role should be, beyond obviously being brain donors on death? Where do you see us being most useful in the process?
So actually meeting people and having the opportunity to understand what are the symptoms that you're experiencing, what is it that affects your quality of life the most, what is it that you're interested in seeing us work on or target or tackle, is quite informative to us. So we benefit as scientists from interacting with you because we become more informed. I'm quite interested in the non-motor symptoms that arise, but I understand that these are quite different for different people and that they hold a different level of importance for people depending on how they experience them, to what extent and in what combination. So I'd say one thing that's really important is for people to remember that interacting with scientists does actually influence the research. It influences what we do and where we focus our interests as well.
I think that's a very good answer. I mean, I used to be a research scientist, and the non-clinical research scientist, and the very first person with Parkinson's I actually met face-to-face was myself. At the point I was diagnosed, I said I really didn't actually know what the condition actually looked like in the flesh until that came about. Also, I think to follow on from that, when I went to WPC for the very first time, I was struck, World Parkinson Congress, I was struck by the mixture of clinicians, scientists and patients, and the patients were fascinated by everything. The scientists were fascinated by the patients, and the clinicians were bored silly, I think. No, I'm so slightly paranoid. I was going to say, Roger, over to you.
I mean, I think you sometimes underestimate the power you have, you see. So when we put Transuro forward, this was in a climate in about 10 years ago when most people perceived that cell-based therapies for Parkinson's had had their day. And so one of the things we did when we were working through the data was, this was through the Parkinson's UK at the time, is we sent out a questionnaire through someone who's on the committee to lots of people with Parkinson's and their carers to say, what would you think about a new trial with cell-based therapies? Because we were being told that patients would not want this therapy because it didn't work and it was dangerous, one thing and another. And of course, you know, you have a bias when you send out these questionnaires, but over 80, 90% of the patients and carers who wrote back said, we think this needs to be pursued. And that had a huge impact on the European Union when we applied, because they could see that actually patient involvement was behind what we were doing, rather than we were just trying to persuade everyone that this is what we wanted. And I think this is really important, because I think as doctors we often put risks, we have to take risks all the time, and we put risks on people, but you're the ones with it, and you'll know what risk you're prepared to take. And it's quite easy for people to say you wouldn't do that because it's too risky. Now, we obviously have to be protective at one level, but actually I think sometimes people are far too conservative in putting risks on you that you don't actually think are a risk. You'd be much happier to have a go with it than not, really.
Yeah. So can I take another question from the audience?
My name's Steve Harris, and I'm the partner of someone who has Parkinson's. It just came down to who owns all this production of all of this of all the drug production, who regulates, and in a market-based system, which we have no power. That actually we who are on the other side, Parkinson's sufferers, and also people in the family. When we're asked to be involved in teamwork, which Roger's taught, it's an unbalanced thing. I might actually want Roger on my team, but it's unlikely that I'll be in a position to actually ask him to be part of my team, because he's got better things to do. And so the invitation, I think, is again that balance of power, is that we depend on researchers to actually invite us in and to define what our role would be. And I'd be interested in Tom was thinking about.
I totally agree with you. I think there's an initiative that we're trying to take on at the moment, which involves us teaming up with clinicians and scientists to so that we have a more holistic view of everything, so that we do work as a team. Where we are, and it's very exciting. So we're trying to build this new website, web portal, which will bring all the various disciplines together, and I think that could, and also we've got the general Parkinson's disease on board as well.
Yeah.
So that is a way forward, and very excited about it.
Can I suggest a third way would be that you go on tour as a stand-up worldwide, and that will be the best possible communication tool.
I don't try to stand up wherever I do.
Can I just say, I mean, it is a very important point, because I think that there's a difference between the journalists and there's a difference between the headline writers. So I think that's the other problem, is the headlines are what get you in, and the journalists themselves can write very good articles. So a lot of the scientific journals, New Scientist, for example, that wrote about transgender, they write very good accounts. So I agree with you. I think it is important that we work together with them. I think the other thing is it's knowing where resources are. So one thing I didn't mention was there is a thing called the International Society for Stem Cell Research. So the ISSCR, which is a big American organisation, and they have really gone out of their way to try and put stem cells into the public patient domain so that people can understand what's out there. So they have on their website all sorts of guidelines for patients and families by which to assess therapies. So I'm very much involved with them, and they've obviously been a bit worried about being too strong about what they say because they don't want lawsuits against them. But actually, that's a source which I would strongly recommend people go and look at, because if you just apply the criteria they put to any trials you come across, it becomes very clear what your decision should be.
Okay, I'm just going to take one more question from the audience, because that's the only thing keeping us from the wines.
I'm Simon Griffith, and I was very excited about the cell therapy area. Can you clarify something very important to me at least, which is if a drug were to protect existing cells from dying or otherwise decaying, being clogged up, could the body actually replenish and grow sufficiently to make a difference to the disease?
So this is a very interesting area, the extent to which the brain can repair itself. So one of the fascinating things about Parkinson's disease is if you lose 249,000 dopamine cells, you don't have Parkinson's, it's 249,000. If you lose 251, you've got Parkinson's. So your brain is pretty good at adapting to loss of quite a lot of cells. The question is the extent to which you can recruit that to actually reverse the disease if you arrest it at one point. And I think the capacity to do that is unknown at the moment, because we're always facing a downhill fight, if you like, that we're losing cells. I think growth factors have the potential to get the most out of your system. I don't think you can make new dopamine cells in the adult brain to replace those that have lost, but you might well be able to get more out of your dopamine system that's there. And one thing we haven't mentioned this afternoon is that these treatments are not mutually exclusive. So I stick some cells in your head and they work. Richard comes up through the linked clinical trials with a drug that slows the disease down or stops disease. Why not have both? So I think it's important, this sort of combination. So I think we talk about these therapies in isolation because when you trial them, that's what you have to do. I can't do 3 experimental therapies in one patient because if it works, I've no idea which ones work. And if it all goes wrong, I don't know which one's caused the problem. But building on what you've got and combining them, I think, is a real future. And that's what happened in the world of AIDS, and look where that got us. So I think the same will happen here with Parkinson's.
Here is obviously a very active group of people that are affected by Parkinson's. How do we get to other people to involve them in the communication about tomorrow and how they can change the world?
I think that's the big question. I think that we need to be out there marketing ourselves, marketing Parkinson's to other people with Parkinson's. I think gatherings like this really help. I think that we can encourage people to become members of our Parkinson movement, which is a website which John and I set up with Sarah Regara of Sweden, which is a patient-orientated website which basically pulls the voice of people, pulls the voices of people with Parkinson's, and World Parkinson Congress is a fantastic venue to gather everyone together. So we may have different voices, but the more voices we have, the more powerful we can become, and so I'm hoping with this new initiative that we can really kick on and become, you know, it isn't just about individuals, it's about all of us. And with numbers comes influence and power.
I mean, it's dramatically changed. I mean, when I started doing research for Parkinson's in the early 90s, the patient had almost no sense. I mean, 25 years on, I mean, you may think it's not very major, but it is seriously different to how it was. The World Parkinson's Congress Coalition, it has changed a lot, and I think the AIDS story is a really good one about how much you can change things with enough input.